Hello and welcome to BWS Awareness Day. I am Bree. I'm the co-host along with host and founder Honey for our BWS Awareness Day. So we are interviewing different people about their BWS story, and we have Bethany and Bill here who are going to talk to us about being BWS parents and just tell us kind of the beginning of that journey. And we're so excited to have you here.
Yeah, thank you for
Thank
having
you.
us. We're very excited about this. Okay, so to start off, we have right now our daughter is 4 years old. Brynlee was, I would say she was an easy pregnancy. So I didn't really have many issues with her until I went for my prenatal scan at 21 weeks and they found an absent nasal bone, which was it's consistent with Down syndrome.
Mhm.
So with her, initially I declined all genetic testing because we had our son was um, more problems when I was pregnant with him. Like he came back 1 in 23 for Down syndrome, but that ended up being negative. So I was like, you know what? I'm just going to leave it in God's hands, and whatever we have, we'll love, and we'll deal with whatever comes at us. So the doctors after that encouraged me to get the testing done just to make sure so that we could kind of plan, like if she did have Down syndrome, we would know how to plan.
Mm.
So that came back negative that I did that, or low risk is how they put it. However, she was born at 34 weeks, decided she wanted to come super early, which was cool. So she was actually really small. Typically, BWS babies are usually larger.
Right.
She was only 4 pounds, 12 ounces. So she was a little baby.
Mhm.
As soon as she came out, we noticed that her tongue was sticking out. And we're like, that's different, but maybe she was just getting used to things, but it was the whole time it was out. So we're like, okay.
And
And
the
then
doctors really didn't say
they,
much,
not in the beginning,
yeah,
whenever she was born,
about
they
it.
didn't say anything about anything. And
Right.
we really didn't bring it up initially.
Mhm.
And then they did all their stuff and took her right back to the NICU because she was a preemie and they needed to get everything going. So eventually the doctor came back and talked to us and said that she had some markers for Down syndrome. So she had the enlarged tongue, she had a flat nose because the absent nasal bone, which was found on the
Right.
anatomy scan. She had a short neck, but didn't have like the fatty tissue in the back that is typical with Down syndrome, but her neck was shorter. And then the intestinal obstruction that she had. So she had a blockage between the small intestine and the large intestine, right where it connects. It was blocked. And the nurse actually realized it. And when she was trying to feed her, she started vomiting real dark green and black. So it's her bowel, she was
Mhm.
throwing up. Um, so right at that moment, they transported her to our children's hospital and she had surgery within 24 hours, which was super quick. And she did
Yeah, that's
really well with
amazing.
that.
Mhm.
Um, so she was there for 19 days. And just the things that they noticed there was just the hyperglycemia.
Mhm.
They tested her for that all the time. I think Honey mentioned earlier in hers about Lady J getting poked all the time and them trying to say it was normal. We know it's not normal.
Right,
Um,
right.
so we kind of just rolled with that. Brynlee's tongue was out constantly. And she even had this tube that had to go into her stomach to suction all of the bowel out of her stomach.
Mhm.
Um, so she wasn't actually fed until day 10 of life. She was on the TPN and just had that constant suction from her stomach. Um, but I decided I wasn't going to like Google anything
Good
or
for
try
you.
to. I did ask about the tongue, like, any ideas why?
I think we were
No,
talking about it because we were both like,
this isn't
this is, yeah,
right.
it doesn't seem right. Yeah.
No.
But everybody kind of just, I don't want to say they blew us off, but they kind of were like, oh, it's okay,
It'll be
it'll be
okay.
okay, she'll grow into it. I
Yes.
Yeah.
just don't think the ones that we were dealing with knew anything about BWS at that
It's
moment.
rare.
Yeah.
It
Yeah.
is. Yeah, yeah.
Yeah. And that's fine. They got educated on it afterwards. I made sure that they understood what it was and I did my
Good for
advocating for
you.
it. um, but so when I came home, 19 days when she came home, I ended up just Googling large tongue in babies. and
Mhm.
BWS came and popped up. So I took it to our pediatrician. He's like, "Oh, I think you might be on to something here." He had only had one that he had ever seen before during his residency.
Yeah.
So Brynlee is his first BWS patient.
And he's
So,
been
and
wonderful.
yeah,
Yeah.
and he's
Oh,
very well known in our area and everybody sees him. He's great. So he sent us off to genetics and that got the ball rolling with everything. But she had like the classic markings of like the classic stork bite. Her face asymmetry, the one side was larger than the other. Um, they did notice that she had a submucous cleft palate, which I'm not sure how common that is. I haven't really met too many BWS parents that have mentioned submucous cleft palate, but I feel like there is some tie to that with
yeah.
the tongue and the palate and everything. And I'm just rattling off all these things that
That's
she
fine.
has
Yeah.
because they could be connected.
Yes.
So there's also, she had a PFO, so she had a small hole in her heart. It did end up closing on its own, which is good.
Yep.
She was diagnosed with scoliosis at 4 months.
Mm.
They call it idiopathic infantile scoliosis because it kind of just appeared out of nowhere. She didn't have it when she was born, but at 4 months, it was there.
And with the Henry
Um,
trophy, things were growing at different rates.
right.
So that
Yes,
makes sense. Yep.
very true. And then she has a mildly tethered cord,
Hmm.
um, which I haven't really heard again, too many BWS parents say that their child has had a tethered cord. So that may or may not be connected. Um, but yeah, these are things like to just keep on the radar
Right.
for could they be? Maybe. So if your child is having these different symptoms or has these, they could be all connected.
And it's a spectrum. So sharing each person's story with all the different, like some of them are going to be common, like the one large tongue, but the other ones you shared that aren't as common, it doesn't mean that it wouldn't be impacted from BWS. It could just be
Right.
another outlier form of that. So
Right,
yeah,
exactly. Yeah, and
yeah,
I'm really noticing that no one case is the same. So
yeah,
it's wild.
true. Yes.
So went through all the genetic testing. First, we had the karyotype done because they thought Down syndrome in the NICU at our
Right.
first hospital. And that came back negative. And then we had the methylation analysis.
Yeah.
Um, was it the methylation first or the microarray? No, microarray,
Yeah.
then
Methylation
methylation,
and then the
Okay.
exome.
and then the exome. The exome actually doesn't show Beckwith-Wiedemann syndrome on it. Um, that's more of it just, how did they explain that? They just said it
Pretty
doesn't
much
show
it
that,
looks
but
at
it's
the
everything else,
yeah,
really.
it looks at like I think it was to determine the reason.
Or if there was another genetic
Yeah, it
disorder
rules
that she
everything.
had.
Sometimes they
It
can come in
rules everything
pairs.
out.
Yeah.
Yeah.
Right.
Hmm.
Yeah.
Yeah. Because the
That's
methylation is what we found that came back positive.
Hmm.
which is that, yeah, chromosome 11,
Right.
Right.
right?
Right.
You inherit both your dad's chromosomes. So that's me. That's what I've got from it. So too.
Right.
Yeah.
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 So
Yeah.
So after that, we were on our way, and then we were referred to, oh, I want to say like between 12 and 13 different specialists.
Oh,
We're
wow.
seeing
Yeah.
so many. And it was fine because we wanted to just cross everything off. If we needed to see them, we'd continue. If not, good. We can cross them off and hopefully don't have to go back to them. So all of that happened. And when they say the first year is the hardest, they're not lying.
Gosh.
That's what I was told initially. The first year is the hardest. I didn't believe it at first. I'm like, this isn't going to get any easier, but it definitely gets easier after the first year.
Mhm.
But now we're down to about 5 or 6 that we see on a regular basis, which is awesome.
Oh, that's good. Oh,
But yeah, I mean, she's been through a lot. She had her tongue reduction done in January of 22. And then she was born in 2020. So her intestinal obstruction was done in 2020,
Yeah.
tongue reduction in 22, and then she had a partial adenoidectomy in 2024.
and what
Um,
adenoidectomy, just in case for people like me
yes,
who might not.
so Brynlee's adenoids were enlarged.
Okay.
She had obstructive sleep apnea.
Oh,
So we thought that would be totally gone with the tongue reduction, but it wasn't. So they noticed her adenoids were so large, her airway was like an hourglass. So
Mm.
she wasn't getting much air. They did that. She's been so much better. I can't say the sleep apnea is completely gone. We didn't do a sleep study afterwards yet
Mhm.
to clear that out.
Can't rule it out.
We can't rule it out completely yet,
Right.
but it's made a huge difference.
That's
So
great.
we only could do a partial because she has the submucous cleft palate. If they would have taken out her both adenoids all the way, it would have opened the palate up, which would have caused more issues with drinking and talking and that stuff. So,
Yeah, speaking of
but
talking, the tongue reduction was like the best thing ever for her. Like
Oh,
after, it was not like easy to watch her after, I'll tell you, but definitely worth it. I mean, she was
yeah,
able to talk almost immediately after. It was like all this
wow.
stored knowledge.
so many different sounds and noises.
Yeah,
Like
like
5 days after the noises we heard were, it was just incredible because we never heard them before. And we're like, wow, this is what you're supposed to sound like at this age.
right.
Oh,
So,
and it was all there. It was just, oh,
yep,
that's wonderful. Oh,
yeah.
Yeah.
Um,
well, it sounds like you guys have all been through so much in a short amount of time. And man, I just can feel the energy and also see how much you've done to advocate
oh
for
yeah.
at such a young age. And like early intervention with any kid is amazing. So, like, wow. Just want
Yeah,
to,
we pushed for it.
Yeah, we did push
yeah,
for it.
We
It
made
was,
sure. I said,
yeah,
don't think I'm crazy. I did Google
you're
and
not.
making sure I know everything and I'm educated in it before I take it to the doctor. But yeah, they were on board with everything. They're like, you got something here, and I think you're right. So everyone has been very supportive with what we've brought to the table.
That's
yeah.
fantastic. That's awesome. And then let me think here. I think we've already kind of shared a couple of those ones. Ooh, what is a tip or piece of advice that has like really made a difference for you and that other people might need to hear? And it can be more than one.
So for me, I don't know if his is different, but I said this earlier that new parents going into this, the first year is the hardest.
Right.
It does get so much easier once you get through the hard part of the diagnosis and all the testing and knowing that your schedule is going to be, bumpy here and there. You have to go and learn all the ultrasounds like make your plan and that's going to be every 3 months and the blood work every 3 months but just the initial diagnosis and getting all this information thrown at you in that first year is the
That's
hardest.
overwhelming.
Yeah,
Yeah. Especially for like,
exactly.
you're not expecting all of that to happen. You just had a baby. You're not
Right.
expecting to have to go into this whole, yes.
Oh
Yeah.
yeah, it
So
is definitely the hardest and it does get easier, I can
that's,
promise you that.
no.
So I don't know if he has anything else
I
that
just think that
from a man's point of view, a dad's point of view.
I just think that, I think trust your instincts, really push for the different things that your child needs. Like whenever we got a couple of doctors that told us, that you're gonna have to really, put it on the insurance companies and continue to call and
Yes.
call.
Yeah.
I think I called every day for what, like,
Oh, it was probably at least a month for that one.
yeah,
Oh,
yeah.
yeah.
Yeah,
A lot of the genetic testing stuff was difficult to secure to make sure that, like we got that for
they
her.
just didn't want to approve it right away. I mean, it is very expensive. It's
Yeah.
like if insurance doesn't help and cover it, I think one of ours was like out of pocket would have been $17,000.
My gosh. Yeah. That's, oh,
Ridiculous.
Yeah.
yeah.
So,
And that's a shame because it could be a barrier for people, and for us finding that out, I mean, to get the diagnosis was huge because then you were able to get all the different services and
right,
things that
Yes.
you need. So it's a shame that, it takes so much work to just get something that should be so easy.
right.
It's
Um,
almost like a second job, I feel like sometimes
Yes.
because
yeah, well worth it. I'll just say that. Just
Yeah.
continue to know that, it'll work out, and just continue to push, and it'll be okay. Yeah.
Hmm.
That's awesome. Yeah. And I would agree with that in insurance part, even just in general. Like once you get any kind of diagnosis that like it can be BWS or it could be another, anything for your kid, like it does open up for speech therapy. Like maybe you need
Right.
OT, maybe you need this, and it just like earlier intervention is so, so positive and helpful.
Yeah. Oh,
Um,
definitely.
Oh, we had all of it too, and
Yeah,
it
and
was a
yeah.
blessing.
take all of it. I would
Yeah.
always say that take all the early intervention that you have
Yeah, if it's offered, definitely
in your
take it.
state. Yeah.
Yeah.
Because I know there's long, wait lists, but get it as soon as you can for your kids. Yeah.
Yes, get on those wait lists. And then early on, I know in our state, I'm hoping, I think that's like a almost every state has it, but it's like early on that will it's free service for like preschool age, and they'll come to your house and do speech and
Yes.
like that. So even
Yeah.
then,
We
like
have that too. Yeah.
you
Yep.
have that too. Good, good. And so that's always something for people who are like, oh, but I don't have that money. If you're in that age like group, early on is there for you for free,
Right.
which is great.
Yeah.
And then depending on if you've got Medicaid, Medicare, see what you can do with your local CMH, as well too. So I know it's a very interesting like navigating everything, but I also see like as parents, as you're doing this and advocating and like being there and showing um Brynlee everything, she's seeing you model how to be an
Yeah.
advocate. And so
Oh,
she's
yeah.
gonna be like doing that advocacy for her.
She already is too. Yeah.
She's got a strong
Yeah.
personality, I'll tell
And
you
she
that.
knows what she knows everything that's going on too, which
She's
is I
smart.
know some families don't like to tell their kids everything like at this young of
It's
an
up to
age.
them. It's up to each family's
Right,
lifestyle. Yeah.
exactly. Yeah, like Brynlee, her favorite things to do are to go to the hospital and see her friends. Uh,
Oh,
for instance, she had an MRI the other day, and she's like, "I get to go to the hospital, yay!" So, I mean, she loved it.
I mean, that's a testament
Yeah,
to her. She's made
we
these
make it
frequent
fun.
visits to the
that's
hospital
awesome.
like a good and positive
Yeah.
thing so that
The
it's not
connotation isn't negative, it's positive.
Right.
Yes.
yeah.
She even
Yeah.
liked going for her quarterly blood work too, which was wild because what kid really likes to go and get poked?
Right.
But we
Right.
had a relationship. We went to the same phlebotomist every single time. They built a relationship, and she knew she would get to go see her and have like special bonding time and earn a little prize after. So, I mean, everything was all positive.
Oh,
So,
that's awesome. Yeah, and BWS, I think kids, teens, adults, we are pretty like strong-willed. My
oh
mom
yeah,
would say that too. I
yes,
yeah, with myself, like like I'm very patient though still and persistent and can be really calm. But if I see injustice or anything like that, I'm like, no. And so I feel
I
like
love
I don't know why, it's just
it's
part of our
great.
DNA. Yeah.
Yeah, it's
Yeah.
awesome to watch.
Yeah.
Yeah.
Oh, that's wonderful. And then is there anything else you want to share? Like any resources, maybe even just like a inspiring like phrase or anything?
Uh, One thing I was thinking about that I wanted to just share overall, now I don't know if everyone does this or not, but I found that during this stressful time, like we were doing a lot of hospital visits, a lot of doctor's visits, I took up crocheting.
Oh,
So that was something, it's like the patterns I do are so easy, they're mindless. So it gives you something like, of course, whenever, like now, Brynlee's a little bit older, she's
right.
running all over the place. I can't sit there and crochet with her all the
But
time
when
without
they're
something.
the first year or so, yes.
Right. So I was able to just sit there and do something mindless, just to not think about anything, give my mind a break. Um, and I just think it's good to pick up something, some kind of hobby or something you like to do, even reading a book, just anything you want to do to just get your mind off of everything for a little bit. Just take a breather, relax. Yoga, you do yoga. So
Yeah.
I know that's a good thing for a lot of people. A lot of people like to do that. Just anything to be able to take your mind off of the stress and anxiety and everything that you're feeling in the moment for um, your child and everything, just to get back to you for a minute.
Yes, I think that's such good advice. And crocheting is great because you can just focus in on those
Mhm.
little things and just like even if you just want to only be looking like loop, pull, loop, pull. You can even
Right.
do
Yeah.
that, and that's fantastic. So,
Yeah.
yeah, finding your own hobby, whether it's like a creative outlet, a movement outlet, anything that's really going to speak to your interests and make you feel like you're you.
Right.
Yeah,
Yeah.
awesome. And then, Bill, what about you? Would you like to say any last
Um,
words of advice or encouragement?
I think that I'm a super positive person, so I think we yin and yang each other. She's like, "Oh
I
my
think you're
God,
better
there's
at the
all these."
positivity and
Yeah,
stuff.
for sure. But there's she's there's all these things, and and I'm like, it'll be fine,
Hmm.
and it will be fine.
Yeah.
Just reach out and use all the different services, advocate and push for all the things that you think that your child needs.
Hmm.
And it will be fine.
Yeah. And find your tribe,
Yep.
people
Yes,
you can talk to.
Yeah,
I
and
know, I know.
that's been helpful
I
for
know that BWS group on Facebook has been a lifesaver for me. Just reading everyone's stories and putting my own out there and people commenting, and it's been wonderful because I'm
that's
learning more from everyone else, and I hope that I'm helping other people. I know there's a couple in our area that I've connected with, um, that I've helped with like resources and stuff too. So I just think it's been a great outlet,
that's
a lot of
wonderful.
support.
Yes, and you are helping people like just by you being you each day and the daily things you do, and then being here, the International Summit, that's a huge deal.
This
Yeah.
is
Well,
exciting. I
oh,
love this.
Yeah,
yeah.
we've also taken the opportunity to, a lot of people don't know this. So, if any, they're like, "Oh, what's that?" We take the time to kind of explain
Yeah.
exactly what it is, so that just one more person knows.
Because in the beginning, it was tough before Brynlee's tongue reduction surgery and her tongue was out all the time. We'd get so many comments. And granted, they were super innocent, but I took them personally like, oh, she has such a cute tongue. I'm like, but she can't put it in. She's not trying to be cute and keep it
Right.
out.
Yeah.
But I had a hard time in the beginning and did a lot of crying, a lot of, it's my fault kind of thing. But
Mhm.
after, you learn it's not your fault.
Right.
This can be used as a time to educate and inform people about Beckwith-Wiedemann syndrome. And eventually, like once I got over all that, I had the courage and the strength and just want to even, obviously now, but at that point, wanted to get out there and just let people know like, oh, her tongue's out because she has a rare genetic
Right.
disorder.
We
It's
took it as an
yeah,
opportunity to teach people, as a
Educational. That's
right,
awesome. And it kind of helps te almost teach people socially too. Like,
right,
you want to
yes,
comment on something like that, or maybe you should just not. And if you do, now you
yeah,
like, get the educational piece behind it, which is good because that makes them go, oh, maybe next time I see something else out in the world, I might want to think about before I
right,
just comment.
yes, exactly,
maybe at least phrase it a little bit better.
yeah,
Right. And just so you don't feel alone, I did not have a tongue reduction, but I did have my tongue was out when I was born as well. And they also were wondering if I had Down syndrome. And then Lynn, who I interviewed earlier, the doctors also thought that she might have it. So it's so interesting because it is that chromosomal methylation,
right,
but it's different. So it's so
right,
interesting
yeah,
to hear all those stories of, doctors just trying to figure out, and that's more common, right, than
right, yeah,
BWS. But yeah, I don't remember when I was looking through my pictures with my mom. I think once I was like 3 or 4, then I started to have it stay in. But
okay,
the way she had to feed me was like she had a tiny little thing that would be right here, and it was like just a milliliter, and she would feed me in my mouth like that for a long time, like dripping.
Yeah.
yeah,
And
Feeding was
then
rough. Yeah.
yeah, and then eventually got better, but you just
right.
what you have to do. She still had that saved too. And
Aw.
so she showed it to me once and I was like,
Aw.
"Mom, you are just amazing." So and she's in the BWS group too. It's been really
Okay.
helpful for her too because she didn't meet anyone that was a mom that had a BWS baby till I did in 2019. We went to CHOP. And so it's just been wonderful for her too. So
Yeah. Well,
anyway,
that's
just
great.
relating a tiny bit.
Yeah.
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 But thank you both so much, Bethany and Bill, sharing Brynlee's story, your own story, all the different ways you can advocate as well, and just have community. And so I'll make sure this is posted shortly, but thank you
Awesome.
again.
Yeah, thank you so
Thank
much,
you.
Bree. This was
Yeah,
wonderful.
it's great.
You're so welcome.